So during the International Myeloma meeting this year at Vienna, I've highlighted some of the important things regarding genomic techniques of like the type of techniques that could be used. So we have like now in many of the academic medical centers what we call like a targeted panel for myeloma, which includes like just the myeloma-specific mutations, and it can also detect copy number alterations that are found in myeloma. Plus, in the same time, by adding some probes for translocations, then it would be a comprehensive panel. And this is implemented in many medical centers, including here and in other medical centers. In fact, also here at Weill Cornell, we have now like a targeted panel that can be used and it's CLIA approved as well. So what we like, so this is the first type. The second type, which is mainly used for research purposes, is what we call exon sequencing and whole genome sequencing. And these are larger scale genomic techniques that can detect more alterations in myeloma, but maybe still it's not implemented yet in clinical care, but only in research studies. And these, of course, provide a lot of information. There was work by us in smoldering myeloma, and in the same time by different groups who have done, like in Dana-Farber, by Nikhil Munshi, and other groups by the MMRF. When they have done whole genome sequencing, they found plenty more of information that we didn't know of about structure variations that occur in myeloma that could indicate that certain patients have a high degree of chromosomal instability. So we talked about all of these and the findings that we have, that these studies reported, and how it improved our knowledge about myeloma pathogenesis and development over time. And I think it would be very beneficial, because I think the future is to kind of classify multiple myeloma, not clinically, but molecularly. And we have now some signals with the venetoclax and the Bellini trial that showed that only certain type of patients, based on their molecular profile, like if they have 1114, or like what the group at Emory showed, that they have like a B cell signature, maybe are the only ones who would benefit from this drug. And it's kind of very intriguing, because it's considered the first like drug that would be kind of part of the precision medicine efforts in myeloma, where it can be used in certain specific type based on their molecular profile. So I think in the future also we'll have more drugs like that, but we need to have like a robust molecular classification of myeloma, and this is what all the efforts that we are doing here and in other centers are trying to do.